Hey, are you looking for shoes that are comfortable, long-lasting, and will prevent pain? Well, to save you money, I think the Mennonites are onto something. I'm Dr. Grant Watkins, and in this video, we're going to discuss of how you may have been led into thinking that your shoes are the problem, and that's a possibility, but it may also just be the way that you're walking. Okay, first off, I want to teach you how to properly walk. And so if you're sitting down, I want you to stand up. I want you to look down at your feet and see of how are they presented. Are they pointing straight ahead? Or do you have one maybe that's flared out more than the other? Are they symmetrical or asymmetrical? Or maybe is it coming in further? That's gonna tell us that there's specific muscles, which ones are tight, that may be doing that foot flare out on one side or the other. But then what it's going to do is, again, it's gonna cause some abnormal wear and tear on those joints. And so what normal is somewhere between about 5 to 10 degrees foot flare. What I want you to watch for is that whenever you do heel strike, so during your gait and just normal walking, you do heel strike, you're gonna be slightly off center from that point of your heel. And so you're going to do a heel strike, you're going to hit on the outside, you're going to roll onto that outside, and that's going to be your mid stance. And then whenever you toe off, you're going to be underneath that big toe and you're going to push. So a normal gait is going to be where your feet pretty much are straight ahead, not 100%, but pretty straight ahead. So if you're not walking like that, many times patients, just whenever I tell them to do that, and they understand that, then they start walking correctly and they don't have as many problems. Some of my patients, they've bought all kinds of different shoes, and whenever I told them, because they're walking completely on the outsides of their feet and they start wearing their shoes out, that just tells me that the wrong muscles are kicking in. So sometimes we have to strip those out, and sometimes we have to strengthen other muscles, but a lot of the times it's just that telling them how to walk and them being able to correct it on their own will start getting rid of many of their problems by themselves. Walking is the best exercise that you can do, and so you're going to get the health benefits of vitamin D on your skin. You're going to get the benefits of just movement and being able to get inflammation out of these joints, being able to stretch ligaments. And again, it's the safest and healthiest exercise that you can do. So this is the time really to start getting back into these routines and start watching of how you're walking, how your patterns are, so you can prevent any kind of problems also. Okay, so if you're in the market for a new shoe, what I'd have you do is just go find one of your old shoes. And what this is going to do is it's going to help you to determine what shoe is going to be best for you. So if you remember whenever you're walking and you do that heel strike, it should be slightly off center. And so it's going to be about right here in this area. And you do that mid stance, it's going to be on the outside. And then whenever you toe off, it's going to be right here underneath the big toe. All right. And so it's going to be those three different areas where most of that wear is actually going to come from. So if we look at like a shoe like this, for example, you're going to have that heel strike. You can see it's happening right here. So slightly off center. It's a perfect spot for it too. You'll get wear on this outside, but then you can see where most of the toe off is about right there between that third and fourth toe. And so it should be underneath that big toe. And so this person's walking too far on that outside of the foot and staying there. If you want a shoe that's going to add more, if you have problems with, let's say, sprained ankles, and sometimes then you got to do a more rigid shoe where it just doesn't allow as much whenever you're bending it, not allow as much movement in there. But if you don't have a problem with that, then you can have something that's a lot more flexible too. And so this shoe is really not going to give any support at all. Although I think this is a really good shoe for most people, but it may be too much if somebody's spraining their ankles a lot to start with. And so a shoe that is flexible is going to allow those feet and those muscles to actually start doing their job correctly and move correctly, as long as you're walking in the right sequence and how you toe off. So let's take a look at this one here. This is actually a boot, and this has a really good wear pattern on there. So you can see that slightly off center, the heel strike is being done there. It comes up and over, and then it goes right underneath that big toe then where they're toeing off at. And this actually is being corrected by an orthotic. So this person's got an orthotic in there, and what you can see with that is that it's built up on that outside of it, and it's forcing that person then over to the outside of that orthotic. They do that mid stance on the outside, and then whenever they toe off, so now they come around that and they toe off underneath that big toe, which is where this is wearing from also. Now this has those lumps in there, so there's 3 different lumps to correct any kind of arches, and these are painful to walk across. So what it does is it teaches the person to to walk correctly and to use the correct muscles on this. Now the other thing that I like about this orthotic too is it bends and it's flexible. If we have a really rigid orthotic underneath the person's foot, what that's going to do then is you're going to all of those muscles and ligaments are not going to move properly, and the joints too, which is really important for each one of these segments to move the way that they are supposed to. An orthotic I only do once in a long while if we have to correct the person of what's going on with them. Most of the time, if I tell them how to walk, they do great with that. And with the shoe, sometimes then we give them some advice on the proper shoe for them to have. But really a lot of the walking too is barefoot walking is one of the best things, which you've probably heard a lot of people talk about also. And that is the foot. It's not forcing the foot into a direction that we think it should go, and that those muscles are kicking in correctly, and you're getting all of the movement into those segments. And so most of the time, a really flexible shoe or no shoe at all is a really great exercise, not only for you, but for your foot also. And if it gets to be too much on the feet, then yes, we get a stiffer foot that's going to take some of that pressure off of the muscles. But long-term wise, we're going to want to move you away from that and get you into something that's more flexible, that your feet are moving the way that they should. So I want to explain a couple of conditions too that that we see a lot in the office. So if somebody's toeing off underneath that, let's say second, third, or fourth toe, what starts happening is that pressure that's underneath that area, underneath those toes, it actually will start creating what's called a Morton's neuroma. And what that is that it starts building almost a fat pad in that area because there's this pressure, and so that inflammation builds up in that area, and the person keeps on putting pressure there. A Morton's neuroma then, and that fat pad that goes around there, will actually start squeezing the nerve. And whenever it does that, now the person will start feeling some shooting pain in that area. And so you can push right into that area. And if it causes pain, or if you squeeze somebody's toes together and they feel that pain, it's an indication that it can be that. The other thing that we see a lot of too is that it can be a heel spur also. So sometimes it's a plantar fasciitis or a heel spur, and you kind of look at the difference between the two. Well, if somebody's doing heel strike directly right in middle, you're right on that navicular bone. So whenever you keep on doing that and you keep on just doing heel strike right there in that area, that starts to build inflammation up in that area also. And that chronic inflammation will actually start to do a heel spur. And it's kind of a little piece of bone that starts to form along the tendon on that. And so we can go right in there and push in on that person's heel, right where the navicular bone is. And if that causes pain, then we'll do x-rays at times to see, yes, that is what it is. But it's more that tenderness right there in that one area. So again, if the person's stepping correctly, that inflammation doesn't build up, and so we can reverse those things or prevent those things many times also. So we have those two things, and then the other one's gonna be that plantar fasciitis, when a person feels pain shooting all the way across the entire bottom of the foot too. And then it can be some tight muscles that are actually causing some of the movement in those bones, that they're not moving the way that they're supposed to, but it also starts to elongate that across the bottom, builds up inflammation on that plantar fascia tension that you have in there. And that will start causing issues also. And so these are really common things that we deal with all the time. And sometimes we need to do x-rays, but most of the time we're always going to be able to figure out kind of which one it is and be able to show you the proper way of, again, walking, but then also proper footwear. And we can alleviate that at times too with either we do taping, sometimes dry needling with it, but we're always going to adjust those bones and make sure that they're moving the way that they should naturally too, of what it was designed to do. All right, so this takes us back kind of to my original observation. And so there's been a lot of Mennonites that I've adjusted over the years, and I always find it interesting that I don't see them with walkers or canes or wheelchairs. And I wanted to understand, why do I not see that in their culture, but I see it so common in our culture. And there's a research that was shown that it's the proprioception on the feet. So when people start losing that proprioception and they're not having all that bone movement, all the those different articulations of bone in the feet, that feeds information up to our brain and kind of shows us where we're at and how we're walking. It's what gives us actually stability. So for the Mennonites, they're walking on different surfaces. They don't have all of these correction kind of devices that we have. And many times they're walking barefoot. And so they're feeding all this information into their nerves, into their feet, and all of that information is feeding up to their brain. So it gives them great stability. The problem in our culture is that we'll have a really stiff shoe. It forces our feet into a certain movement. We also end up having hard orthotics that's in there. And then we're on flat surface. You get out of the car, you go into a flat surface store, you shop around, you come back out, you get into your car, you go home, you go into a flat surface. It's just that we're constantly on this flat surface. So we have to have this movement and articulation between these bones. If we don't do that, then the problems that it's going to cause is stability as we start aging. And so this is why it's important to, make sure that, yeah, you're getting a good shoe that's getting good movement into the feet. And barefoot, again, is always going to be a really good exercise that you can do. You can't do that all year long, but whenever you can, it's going to be a great exercise for you to be able to do. And then the therapies that you can do for it too is, have one of those spiky balls and roll that across the bottom of the foot. That's going to help feed that proprioception too. And so all of these things need to be built into your routines, and it's going to help you create stability. And then there's a couple of things that I want to show you that's going to allow you to be able to test too, to see how is the mobility too that you have in the feet, but it's also going to show you even in those hips and knee points also. A couple of things that you can do that's really easy at home is that, and be safe with this too. So if you need something next to you, you can have a chair next to you that you can stabilize yourself with. But and this is an easy one to do for both your ankle, your knee, and your hips, but it's just a deep knee bend. And so if you're looking straight ahead, you should be able to go all the way down. And this again is going to assess that ankle, the knee, and the hip. If you're not able to do it, that's fine. It's just going to tell us that there's certain things or issues that you can have, and that there's some correction that need to be done in these areas, okay? So that's an easy one to do, and that's a hard one too, but it is an easy one that you can do on your own. The other one that you can do too is you're going to take about the thickness of your fist here. You're going to be up against a wall, and you want about that amount of thickness from the wall to your foot. So both of your feet are going to be facing straight ahead, and you should be able to lean right into that wall without that heel coming up. Same thing with that deep knee bend. If that heel comes up, it tells us that this gastroc or this muscle back here is just too tight, and so you're not getting as much mobility or flexion in that. And the other exercise, and this should be done on both sides too, where you should be able to get that movement in there on both sides. If you feel a big difference on one side than the other, that's going to tell us too, there could be an old injury that you have on one side, maybe some scar tissue, or the muscles tighter on that side for some reason. That can be because of the body mechanics or how you're moving. All of these things should be pretty symmetrical. To stretch those gastrocs if you need to, it's just this wall exercise that you have. So both of your feet are facing straight ahead. And what you're going to do is you're going to lean forward. So it's this back leg that I'm actually paying attention to. You lean forward, and whenever that hip or the leg starts coming up, that heel starts coming up, then what you're going to do is you're going to go up on your toe for a count of 10 seconds, and then you relax, and you go a little bit further forward into that. That heel starts coming up, and right there you can see my heel starting to come up. Same thing, you're going to go up for a count of 10 seconds. 9, 10, you relax it, and you lean a little bit further forward until that heel comes up, and right there my heel starts coming up. You're going to do the exact same thing. You're going to go up for 10 seconds, 9, 10, relax, and go further forward until you stretch that thing out as much as you can. Right there, I'm getting a real good stretch in there, and you're done. So you're going to do that 3 times on each side. And then the second one is you're going to bend that back leg, and you're going to do the same thing. Now this is going to be a deeper muscle. This is the soleus muscle. And so I'm going to start leaning forward, and you can see that starts coming up much faster for me on that. So right there, my heel starts coming up. I'm going to go up for a count of 10 seconds. 9, 10, relax. And I'm going to lean further forward until that heel comes up. There it is already. I'm going to go up for 10 seconds. Relax. And one last time, up for 10 seconds, relax, and stretch it out a little bit further forward. All right, so to recap is make sure that you correct how you're walking if you need to. So you're walking correctly, your gait that you're doing is correct. The next thing is that do you need to correct your shoes so that your wear patterns have been corrected, and if you need to do any specific exercises then to stretch out some of those muscles. And so I hope this has been great information for you. Make sure that you like and subscribe for more tips and information. And if you would like to see one of our providers too, you can go to spinestop.com, or you can find the link in the description.